Hi guys, and welcome back to my channel. So today I'm going to be talking about my surgery in the Dominican Republic. I had my surgery on June 18th. So I'm officially 2 months post-op. I think I might do this in a two-part video so that I'm able to be really specific and tell you kind of like all of the details as far as, you know, obviously pricing, location, experience, pain, necessities, and all of those things. So I don't think I'll be able to fit all of that in one video, so I may do a two-part just depending on how it goes. But let's go ahead and jump right into it. So I had my surgery done in the Dominican Republic with Dr. Tactuk Simo. The reason why I chose the doctor that I chose was because I have seen his work. I had a few friends that went to him. His work is very natural but just really beautiful, so I really wanted to obviously go with someone that was going to give me exactly what I wanted. I had looked at a few other doctors here in the States, but I was having trouble finding someone who saw my vision for the surgery. For example, I had went to a few different places and they were, you know, overall basically just telling me that I was way too skinny. I didn't have enough fat on me to do it, and that if I wanted any results at all, and even then the results would be very minimal, I needed to put on 20 pounds for the work to even make sense. And I thought to myself, there's no way that I'm gonna put on 20 pounds. Like, that's just ridiculous. There's no, just no way I could do it. So with all of that, I decided to look into the Dominican. And then of course, after seeing my friend's work, I just felt like that was the best thing for me. So anyway, I started to communicate with Dr. Tactuk, but he did tell me that I was gonna have to gain about 15 pounds, 10 to 15 pounds. So I felt like that was more reasonable. I went ahead and I booked him for my surgery. So procedures and cost of surgery. I got a breast aug, BBL, and lipo. So for me, I didn't want anything crazy. I didn't want to look like a different person or anything, you know, dramatic. To each his own. People typically go out there to get those results, but for me personally, I enjoyed my body. I really liked it. I really just wanted my body but better, and he was the exact doctor to do that. So now as far as cost, the cost was $4,500 USD for the work. The flight there was $1,000 round trip. So that ends up being $5,500. Now also, if you want to take a person, you're gonna have to also factor that in. I took my best friend, so that ended up being $6,500 USD. And then you also have to stay in a recovery house whenever you're there, which is, I believe, another $750 if I'm correct. You're also going to want to factor in your garments and your BBL pillows. So after surgery, I got a garment from him. He gave me one, and then my stage 2 garment was, I believe, $130. And then I got a stage 3 garment, which was another $120 or $130. And I'll link those in the description bar below. I got those on Amazon. I also purchased boards. They're just like foam boards that you put in your faja after surgery, so that way when you're kind of sitting or moving, it doesn't create like an indentation in your stomach, because your faja will kind of like fold and create this really like weird separation line in your stomach, and you don't want that. So the foam boards are really important. And then also the backboard, and those I also purchased on Amazon. And then the pillows. So originally I had purchased the Bobby pillow, which is, you know, the baby pillow. That was about $40, I believe, at Target. And I thought that was going to be enough for me. So I used that for the first few days. And then I realized, no, it's not working too well. So I ended up getting the BBL pillow whenever I was out there. And that one was $120. So all of these, you know, prices come into play. Also, when you're out there, you're gonna want to get massages, and I believe those are 10 massages for $200, but that is only in the Dominican. So once you cross that border, you come back home, you're looking at about $1,000 to $1,500 for your massages, and you need, they say, at the very least 10. So for me, total, I ended up spending about maybe 7,000 USD. I personally paid for it cash. I didn't want to have anything on my credit, but if I'm correct, you can do some kind of credit. Theirs is a little bit different. Obviously, here in the States, we do care credit, And over there, I'm not sure what they do or if they even do it at all. I imagine that they do, but I'm honestly not sure. Like I said, my personal preference was just to pay for it cash and just get it over with. So a little bit more in depth on the surgery and my experience. So I cannot remember for the life of me if I was given a blue pill. You will hear most girls that had their surgery in the Dominican saying that they got a blue pill. I honestly can't even remember, but I know that I was hooked up to an IV, and obviously that initially gets you drowsy. And then I was given an epidural. With the epidural, I was entirely and completely numb once it kicked in. So they had to flip me to even be able to start the surgery. They started with my arms, and I was able to handle one whole arm, but at the end, it was just way too painful. And I'm very, very tolerant of pain, but it was just way too painful and I couldn't take it anymore. So he ended up putting me to sleep. And I woke up, I believe at the end of the surgery, and I was trembling so much that I almost felt like I was having like a seizure or like a panic attack. But it is completely normal. But I can't lie, it is scary. There's no denying that. But yeah, I was really, really shaky, and they do tell you that. They let you know that in advance. After they put my faja on, and then they threw a cover on me and took me up to my room, and then I obviously got under the blankets there, and it settled down pretty quickly. The pain level on the first day was a 10, and again, I am very tolerant of pain, but it was pretty bad, to the point where I was crying. And I don't ever cry about pain. Like, that's just not how I am, because I can pretty much take any pain, but it was bad. So I just remember like begging for more pain meds, and they wouldn't give them to me. And then the doctor came in to see me, and I told him that I absolutely needed something, so he made them give me more pain meds. Then after the pain meds, for the rest of the day, I was pretty fine. I felt better within a few hours, and I was able to, call my mom and kind of talk to her and stuff. So the major pain didn't last too long. Day 2, the pain was better. It wasn't as bad as day 1, but it was still pretty tough. But of course, that's what you expect coming out of surgery. That's absolutely normal. Day 2, whenever I woke up, they brought me breakfast. I couldn't really eat. I just didn't feel up to it. I don't know if I didn't feel hunger or if it was because the faja was so tight, because the faja is tight, very tight, uncomfortable tight. And so I don't know if it was the faja that just made me feel like I couldn't eat, or if I just really didn't have an appetite. So I tried to eat as much as I could. It was obviously a Dominican dish, but what I could compare it to was arroz con leche. And it was just a little bit more, it was more soupy. Like, it didn't have like the grains of rice. It was more oatmeal-y kind of, as far as consistency. But it was really, really good. I wish that I got the name of whatever it was, because I actually really, really liked it. I honestly couldn't take much of it down, so I ended up, I think, just getting some yogurt, and then that was it. I ended up leaving the hospital around, I believe, 10 a.m. and that's whenever I went to the recovery house that I was staying in. Once we got to the recovery house, I instantly felt so much better. There's just something mentally that feels a little bit uncomfortable being at a hospital. So once we got to the recovery house, I just felt a lot more at home and comfortable. So we got to the recovery house, and then they gave us like a smoothie or a shake. And those are really important during the recovery process, to drink lots of like juices. So it's kind of like a frozen juice kind of thing. And then we had lunch, and I can't remember what it was now, and then dinner. So they feed you your meals and give you your medicine, and then they also help bathe you and wash your faja, and you also get your massages at the recovery house as well. So it's kind of like everything there. I also didn't need much help at the recovery house. The only thing that I really truly needed help with was getting up. That was the most painful thing for me, just because my whole back was just like done. Like, it felt like I got ran over by a bus, and I looked like it too. Honestly, I had bruising like everywhere. So I feel like that was the hardest part for me. Even then, day 2, I was able to use the restroom by myself. Typically, you hear about women getting like the urinal cups or like funnels. I personally didn't need one. I was able to use the restroom just fine. And also in your fajas you have like an opening that you don't have to like do anything. You don't have to take it off to use the restroom or anything. You can just instantly use the restroom when you go, so you don't have to take anything off, which was, you know, really good. Yeah, so for me, I didn't need a funnel. I didn't need help going to the restroom. I just needed help getting up to be able to go to the restroom. For me, I was fine. Maybe I was straining my body, I don't know, but I'm just a very independent person, and it really bothers me to not be self-sufficient and have to depend on people. So I just, going into it, I instantly told myself like I needed to do as much as I could, because that's just how I am. So for me, it was not that bad. Now day three, it got a little harder. For some reason I was thinking day 2 would be pretty hard, but it was okay. Day 3 and day 4 I think were the toughest for me, and not pain wise but discomfort wise. So I don't know if that makes sense, but day 1 I was in a lot of pain, unbearable pain. But on day 3 and 4, I was just so sore. It felt like I had done like a major workout, and you know that ugly feeling that your body like has after a really aggressive workout a few days later. Like it just feels sore. Like any movement you make is just like a major soreness. That discomfort like really got me. But it wasn't painful. It was just annoying and, like I said, just uncomfortable. I cannot lie, the pain pills didn't really help. The ones that they prescribe you, I just personally didn't feel much relief with them. So I think that's another reason why day 3 and day 4 were pretty tough for me. I ended up having my best friend go out and get me some extra strength Tylenol. So once I got that, I felt a lot better throughout my days. It was very hard for me to eat and like keep food down. So for me, I had to kind of like walk around and eat at the same time for it to like even go down. I felt like my faja was kind of like stopping food from like going into my system, if that makes sense. So I would walk and eat at the same time. By day 3, I was up walking already, only because I was going to be leaving a little bit sooner than most. So I wanted to be able to get my legs ready and my blood pumping and, you know, all of those things, so that way I wouldn't experience any blood clots on the plane. Now also, getting out of the faja was painful. Your body becomes so dependent on the faja that once it's taken off of you, you feel like you are going to pass out. I think some girls do. For me, I didn't, but I did vomit. I vomited the first time I got out of it, and then the second time I felt like I was going to, so I had to just like bend over on the trash can and just like hold it, because I really felt like I was gonna throw up. Also with the massages. So with the massages, I didn't feel really any pain. I honestly expected it to be very painful. I was very scared to get my first massage, but it wasn't bad at all. The only pain that you like kind of feel, or like pressure that you feel, is whenever they're draining you. So there's fluid that's in your body and they drain it through pretty much like your stitches that are, you know, because they're still kind of open. So they'll push the fluid out your stitches, and your stitches will just kind of like leak that fluid out. Kind of like a red color, so you feel like it's blood. It's not, it's just, you know, it's fluid. But I actually had to be drained. I had to be poked through my stitch to be able to drain the fluid out. And I think it's just because my body naturally heals quickly. I've gotten 1,000 cuts, burns. Anytime I've like gashed myself open, it's like closed within like 2 days, which is absolutely insane, but that's just the way that my body works. So for me personally, the experience was not that bad. Of course, when you're going through it, it's terrible. Like, I complained every single day. It was just like so annoying, and I would have rather been home to recover. Obviously, anyone would. My best friend really made it the most pleasant experience possible, so I highly recommend taking someone with you. Now, I think that's it for the overall like experience there. Going to the airport, they have you, or at least my recovery house had them put me in a wheelchair, so I was wheeled around the whole entire airport. I didn't have to grab anything, didn't have to walk, didn't have to do anything. And then I was wheelchaired pretty much throughout my whole trip. So from the Dominican, we had a layover in Miami. So as soon as I got off the plane, I had a wheelchair. And then from Miami to Houston, obviously there I had a wheelchair as well. So that was really easy as well. On the plane, it was uncomfortable. I had to sit on my BBL pillow, and it was irritating, not comfortable in the least. But of course, those are things that you kind of have to expect. Now, getting back at home and recovering. Once I got home, I had to sleep with tons of pillows under my head, my back, my legs, and then I slept with my BBL pillow on pretty much my lower thighs. So that way I was up at all times and my butt wasn't touching the bed. I slept like that for pretty much the 2 months, more or less. You cannot sleep on your breast, and I don't know for how long that is, but I just didn't want to take any chances, so I didn't. And typically I do sleep on my face. I've always slept on my face, so that was very, very hard for me. I could not sleep most nights. I think that was pretty much the most annoying part of the recovery process. It wasn't even the pain or discomfort that I felt. It was not being able to sleep, because I love my sleep. So that was really the most uncomfortable part of the recovery. Also, not being able to eat because of the fajas. But as you kind of like get used to it, obviously, you're able to take more down. Now with the massages back at home as well. The massages back at home were painful, to say the least. I stopped my pain meds early because I didn't want to become dependent on them. I'm not a person that takes a lot of medications. If I'm in pain, I'll usually just stick through it. Period cramps, whatever. I'm a person that just likes to tough through things because I just feel like it's not good, to take a lot of things like that. So I got myself off of them 1 week into being at home. So I took them for about 2 weeks, more or less, after surgery, and then stopped them entirely. So whenever I would go get my massages, it was very painful, not gonna lie. It just feels like someone's just like punching your bruises or something. But I honestly would recommend taking some pain meds before you get them, because it's definitely going to help. I kind of regret not doing that, but I'm kind of past it, so it's not so bad now. But in the moment, it is pretty painful. So also with massages, some people do not consider them very important. Some doctors pressure them, some don't. My doctor wasn't too pressuring on them. Personally, I saw a difference whenever I got them, so I wanted to keep doing them. They do help with draining the fluid out of your body, and obviously the more fluid that you drain, the skinnier you look, because coming out of surgery, you look almost like, why did I even do this? I look the same, or if not bigger, because you're so swollen, and also that swelling mixed with the fluid just makes you look, pretty big. So once I started getting the massages, I really was seeing a major difference with how my body was like forming and shaping, and so I decided to stick with them. I do also want to mention that the place that I got them done here in Houston, they're called DC Medical Spa. They do offer care credit, so if for any reason it's just not something that you have in cash, definitely try that route. And then also what I did was I would watch how they would massage me. And so the days that I couldn't make it out, because it's about 45 minutes for me, so the days that I couldn't make it out there, I would just massage myself. And what I would do is I would use this baby oil gel. I personally don't like the smell of like baby oil or like baby products. It smells like diaper to me. I just don't like it. There's another one, and I can't remember the brand or the name, but I'm gonna try to find it. And it's like it's an oil gel, but it has like coconut oil or something, like cocoa butter or something in it. So it has more of a pleasant smell. So I would use this to massage my body with, and then at night in the spots that I had the most fluid in, because they'll kind of like tell you where you have fluid, I would put icy hot packs on them to kind of like help melt fluid. And obviously I'm no doctor, I don't know if it really worked or not, but I did see a difference. So for any reason you just cannot afford the massages, that's what I would recommend doing. Looking on YouTube, seeing how they do the massages, do them to yourself. I also saw this massage thing at my local HEB, and it's like it it has like two settings. It has like a cold setting and a hot setting. So obviously you would want to do it with the hot setting to just kind of like break down any fluid. And then also, like I said, the icy hot packages really came in handy too. But also with doing it by yourself, you know, it is, I feel like sometimes it can almost be more painful sometimes, but they honestly are very important. And so I would recommend doing some kind of massages in some kind of way. So I believe that is everything. I hope that that's everything. I try to answer all the questions that everybody asked me. I filmed this video like 2 other times and messed it up both times. One time I didn't have audio, and the other time I don't even know what I did. So I think this one may have been faster just because like I refilmed, and so I try to get all the information. So if there's anything that I missed, please comment and I will try to answer. Now we're gonna go ahead and I'm going to show you what you came here to see. So obviously I have my mics on, but these are the breasts. Originally I had a 32B. That was with the weight gain. So prior to that, I feel like I had an A. Now I am a 34C. So they're pretty small. They're not anything big, not anything crazy. I really, really love the size so much. I feel like they're just like a handful. Like I said, nothing too crazy. This is exactly what I wanted. I've always loved small breasts, so I feel like this is like just enough. So I have this sports trainer thing on right now. This is what I use throughout the day to help like really cinch my waist. So this is what my waist looks like. You can see it's pretty small. My waist is looking like, you can see my shorts are big. They don't really fit me. Yeah, so that's my waist. So he also did my arms, like I said, because I had gained weight on my arms. So there goes those. I still have a little bit of like swelling right here in this area that's initially supposed to like go down and like come in a little bit more. But anyway, this is what the butt is looking like. I've always had butt down here. So what he really did was he filled in kind of like this upper area and this side area, because my butt was always like pretty full, but it kind of went down on these two areas like most natural butts do. He basically like filled it to give it more fullness. This is more or less what I'm looking like. So again, I chose my doctor because he gives really natural results. Obviously my body looks like mine, but just a little bit better, almost like Photoshop in real life, which is exactly what I wanted. I didn't want anything crazy. I didn't want anything too far off from what I, you know, initially looked like. So I'm personally very happy with my results. I would definitely recommend him 100%. He's so personable, makes you feel so comfortable, and he's the one who like communicates with you throughout the whole process. So he just makes you feel like he really cares, you know, about his patients. So overall, I had a very successful experience, and especially for the price. You definitely would not get that price here, you know, in the States. And also, you know, for those of you that are scared, because obviously going to a different country is scary and you don't know, you know, like what's going to happen. My doctor has no bad reviews. I try to do as much research as possible before I even, you know, stuck with him, despite the fact that he had done people that I knew. I wanted to really be sure in what I was doing and who I was choosing, because you know, you can die, and that's with any surgery, no matter where it's at, you can die. But for that reason, you know, I was very apprehensive, but I couldn't have chosen a better doctor. He's a very, very safe doctor. He doesn't push his limits. He doesn't take more than what he can get. And you know, most doctors in the Dominican and Colombia do that. He's just not one of them. So I personally love him to death, and I would definitely recommend him. So if any of you guys are interested and you do contact him, let him know that I referred you, and I believe he will give you a discount. Thank you guys so much for watching, and I'll see you in the next video. Bye.